Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Anticholinergic drugs. Anticholinergic drugs, these are the drugs. We use anticholinergic drugs which have a higher central to peripheral ratio. So the anticholinergic drugs with central to peripheral ratio, that is their action should be more in central when compared to peripheral. So these drugs include benzhexal, biperidine, then we have benzotropine. So these are the drugs which have higher central action and lower peripheral action. These are actually the drug of choice for drug induced Parkinsonism. We can use these drugs. These drugs will also improve the tremors and rigidity. These will improve the tremors and rigidity of the Parkinsonism, but it will not affect the bradykinesia, or it has very little effect on bradykinesia. Okay, the side effect of this anticholinergic drugs are, because anticholinergic drugs will cause um, will block the secretions, so they will result in dry mouth. Okay, and this dry mouth will result in acute suppurative otitis media in some, sorry, acute suppurative parotitis in some patients. In some patients, because of this dry mouth, the patient might develop acute suppurative parotitis.
thank you and thank you for watching.